Hi, this is Jeff Waldberg from OrthoPro Physical Therapy and the Runner's Clinic. Today we're going to talk about hamstring injuries. The hamstring consists of three muscles, which are in the back of the thigh, one on the outside and two on the inside. It can be injured right in the center of the muscle belly or at its origin, where it begins right at the bottom of the pelvis. The hamstring attaches at the back of the knee and also on the outside of the fibula. From this front view, you can see that the bottom of the pelvis is where the hamstring begins. When the hamstring is injured at this point, sitting on a hard surface can cause more irritation and pain, while sitting on a softer surface is usually more comfortable. The hamstring has two jobs. One is to bend the knee on the takeoff, bringing the leg up. The second job of the hamstring is to act as a brake as the leg is coming forward before it lands on the ground. So here's an example of a delayed takeoff. You can see the 17-degree angle. It should be a little less than that. So what happens, you can see how the hamstrings right there, kind of the fibers are a little bit further back, the distance to the heel, and look how relatively large this arrow. The arrow represents the work that has to be done. Another example of this can be seen by trying to do a biceps curl with the upper arm further away from the body. This is going to produce a lot more work for the biceps with each repetition. You can see how inefficient this position is. Look how long the arrow is. It's the distance from the biceps to where the weight is in the hand. Now let's look at more optimal takeoff that's not as delayed. You can see the angle is 15 degrees and the fibers of the hamstring are closer to the center of gravity. The leg is not as far back. So here's the back of the foot and the arrow is ever so slightly smaller, which means less work each time that you take off. Now let's look at a more optimal biceps curl. You can see that the elbow is at the side and the line is going to be much better. Shorter arrow means less work and more efficiency. So here are some simple fixes if you have a hamstring strain. The first thing you should do is change how you run in terms of both form and training. Between the two, form is more important. Another thing that you can do is try to get some local treatment. Things like ultrasound and massage can really help. And if the injury is really in the muscle belly or in the center of the muscle, you can use an ACE wrap to gently wrap it before you go out and run. So here are some simple measures to prevent injury. Make sure that your cadence or the number of foot strikes you use is optimal. Running at too slow a cadence can definitely bring on an early hamstring strain. The second one is similar to the first. If you have an earlier takeoff, it'll keep your cadence higher and also prevent injury. And last but not least, watch your speed. Most hamstring injuries occur when people do track work or fartlek work, so be careful. Thanks for watching. Call or contact us if we can be of any help. Good luck and happy running.